So any good steward of medicine will tell you there's good and bad, yet we won't talk about any of the good in medicine. Whoops. So the worst side effects, I think, on the radar today are uncontrollable vomiting, Cannabis Hyperemesis Syndrome. And ERs, if you look at the emergency room data, will say, oh my God, this is a calamity. It's a huge problem. We're seeing this so many times more than we used to. If you, depending on how long you look at this scenario, how long you're thinking about it, you can say, oh shit, this is a real problem. Or you can zoom out and say, wait a minute, a lot more people are consuming cannabis because there's cannabis everywhere. And if that bell curve is getting bigger, the teeny tip of people that are experiencing the extremes is going to get bigger too. The problem isn't bigger, we're just seeing more of it. Confirmation bias. So that's probably the most alarming thing. I see hundreds of those patients, and you work it through, that you help them get to a level of tolerance which is lower, those symptoms disappear. Not the end of the world, it's really an awful thing to experience for them, but it's not a long-lasting thing, it's not a permanent thing. Beyond that, hangovers or stonovers is probably another common one. Dizziness, lightheadedness, people have GI stuff. If the dispensaries are telling people they need to have a tincture, an oil-based tincture, as the way that they consume cannabis, if they're drinking a lot of oil, if anybody had a lot of oil, you're going to get the runs. Or constipation is also a thing people find. So potential side effects is almost everything, just like the potential benefit is almost every system. You can have potential bad effects depending on where the person's starting from.